In students with diabetes, the pancreas either doesn't produce enough insulin, stops making insulin completely, or the body itself becomes resistant to insulin and doesn't use it effectively. How does insulin work? We eat foods that are broken down into glucose, also known as sugar. Glucose is used by every cell in the body for energy. Insulin is the key that allows the glucose into the cells. Without insulin, glucose cannot enter the cell. Glucose stays in the bloodstream, creating high levels of blood sugar. As discussed, there is type 1 and type 2 diabetes. Type 1 always requires insulin because it is pancreatic failure to produce insulin. Type 2 is usually insulin resistant and can lead to the use of insulin, but usually starts off with oral medications to reduce blood sugar and improve the level of insulin resistance. Type 1 diabetes is a disease of the immune system that attacks the insulin-producing cells of the pancreas. Students with type 1 diabetes, which occurs most often in children, need to take daily injectable insulin for life. Symptoms of the disease can include increased thirst and frequent urination, constant hunger, fatigue, weight loss, and blurred vision. Type 2 diabetes typically involves a problem with the body's response in insulin or insulin resistance. To control diabetes, students with type 2 may need to take oral medication, insulin, or both. Symptoms can be very similar to type 1 diabetes. Some key facts: it is not contagious and is not caused by eating too much sugar. Complications from diabetes include poor glycemic control, which will lead to hypoglycemia or hyperglycemia. Hypoglycemia, also called low blood glucose, occurs when blood sugars drop below 70 milligrams per deciliter. It is one of the most frequent complications of diabetes and can happen very suddenly. Hyperglycemia, also called high blood glucose, occurs when blood sugar exceeds 240 milligrams per deciliter. Hyperglycemia may be caused by too little insulin or by dietary disruptions, eating more or different foods than planned, for example. There will be treatment plans available for every student with diabetes, diagnosed diabetes, and medication for how to intervene when they are either above, below, or euglycemic, or at the goal level. If you or someone Mild hyperglycemia is not a medical emergency. However, it can impair academic performance. Hyperglycemia may occur if a student is becoming ill, eats too much, misses an insulin dose, is under a lot of stress, experiences growth spurts. Hyperglycemia may also occur as a side effect of some medication. Symptoms include extreme thirst, frequent urination, dry skin, hunger, drowsiness or fatigue, nausea, abdominal pain, or blurred vision. Seizures. A seizure is a brief episode of disorderly electrical activity in the brain which affects its normal functions. It often produces changes in a person's movements, behavior, and even consciousness. Epilepsy comes from a Greek word meaning to seize. Seizures are a common form of epilepsy. Approximately 315,000 school-aged children in the United States have been diagnosed with epilepsy or a seizure disorder. Some facts. Types of seizures. Many school staff mistakenly think that a seizure is a seizure, when in fact seizures are classified in two types, partial and generalized. Partial or focal seizures result from abnormal activity in just one part of the brain. Generalized seizures involve all of the brain. In some cases, seizures can be in one part of the brain and then spread throughout the rest of the brain. Partial seizures. There are three types of partial seizures: simple, complex, or secondary generalized seizures. There are four types of primary generalized seizures: tonic-clonic, also known as grand mal, absence, myoclonic, and atonic. The type of seizures most commonly seen in school settings are tonic-clonic, absent seizures, in a tonic-clonic or grand mal seizure, the victim blacks out, falls, stiffens, and then jerks uncontrollably for a minute or two. This is the type of seizure most people picture when thinking about seizures in general. A little bit of a tongue twister there. There are two phases of tonic-clonic seizures. Tonic phase, in which loss of consciousness occurs and the muscles suddenly contract and cause the person to fall down. A period of rigidity follows, aka stiffness. Clonic phase, in which the muscles go into rhythmic contractions, alternately flexing and relaxing. Convulsions usually last for less than 2 minutes. Absent seizures, also known as petit mal seizures, are very brief, lasting only a few seconds. People experiencing an absent seizure usually have a blank stare on their face, as if they're daydreaming, and are completely unaware of their surroundings. These seizures begin and end suddenly. Absent seizures occur most often in children. Simple partial seizures do not result in the loss of consciousness. They may alter emotions or change the way things look, smell, feel, taste, or sound. Complex partial seizures alter consciousness, cause the person to lose awareness for a period of time. Complex partial seizures often result in staring and other odd behaviors. Seizures in the classroom. All school staff members can take proactive measures to effectively deal with seizures when they occur in the school and in the classroom. Be familiar with the needs of your students who have chronic illnesses. Review their healthcare plans so that you can be prepared to assist them in emergency. Document seizure activity, including the duration and statistics, in the student's log attached to their healthcare plan. Be sure that the substitute teachers and other school staff in contact with the student are aware of his or her health concerns and know what to do in the event of a seizure.